Every year, more than 600,000 women in the United States will undergo a hysterectomy. But some doctors believe many of these women don't really need the operation. According to medical studies, 90% of hysterectomies are performed for benign reasons, such as relieving the symptoms of uterine fibroids, non-cancerous tumors that grow on or within the muscle tissue of the uterus. Common symptoms associated with fibroids include heavy menstrual bleeding, pelvic pain, and urinary frequency. Uterine fibroids are the most common benign tumors within the female reproductive system, and most women are at risk for developing them sometime in their lives. But is it necessary to undergo invasive surgery to treat the symptoms associated with uterine fibroids?
Well, UFE is an excellent alternative procedure because it offers a patient a much less invasive way to treat their fibroids. Fortunately, over the past 8 years, there's been a lot of literature that shows that this is a safe procedure that works very well.
And that's good news for the hundreds of thousands of women seeking relief from painful uterine fibroids.
This is a fibroid. There's another fibroid down here.
I opted for this procedure mostly because of the recovery time. I didn't want to be bedridden. I didn't want the stitches. I didn't want the healing from the inside out. I didn't want the pain that goes along with the hysterectomies and the other procedures.
Uterine fibroid embolization is a minimally invasive procedure that relieves symptoms by using embosphere microspheres to block the blood supply to the fibroids, causing them to shrink. UFE is the only non-surgical treatment for fibroids that has been available for over 10 years and used to treat over 50,000 women worldwide. But how do you know if UFE is the right treatment for you?
Most women who have fibroids are candidates for UFE. We generally don't want to treat patients who have other underlying uterine pathologies, such as endometriosis or a history of uterine or cervical cancer. Well, hello, Mrs. Smith. How are you?
Many clinical studies show that UFE is actually less expensive than surgery, which is due to the shorter recovery time as an outpatient procedure, fewer complications, and less narcotic use. Furthermore, UFE is available everywhere and is covered by most insurance carriers.
The next morning I went home with my medications. I walked, did lots of short walks at home, and by the end of the week I was shopping and traveling.
Uterine fibroids are a concern for many women. To find out if you're a candidate for UFE, it's best to consult an interventional radiologist who will work with your OB/GYN to provide the best possible care for your symptomatic uterine fibroids. To locate an interventional radiologist near you, go to askforufe.com. It may be the choice that's right for you.